And Lifts, your stairlift expert.
Okay, you know it if you've lived in Chattanooga any length of time that we are an exercising town, we are a runner's town, and an awful lot of us out there end up having problems with our knees over time. Thankfully, Allan Valenzuela is here with Alliance Physical Therapy. You've got something, is it brand new to you or brand new on the market?
It is brand new. It was developed in Canada actually, and there's only 7 states that have it. It's called the knee KG, knee kinesiography.
Okay.
And Alliance actually is the only physical therapy company that has it in the greater Chattanooga area. So only 7 states have it.
Okay, so I'm going to pause a minute, and if you've ever known anybody who's had problems with their knee, maybe they've had to go through knee replacement surgery, right? And sometimes it's highly successful, sometimes there's a little bit of a kink. Always, I think there's some angst, right? Am I doing the right thing?
Right.
You're not advocating one over the other, but often people come to you and they need some help with a joint issue with their knee, and you want to make sure you're getting it right.
That's right.
This helps you to do that.
This technology is cutting edge. There's nothing like it. The name of it is genius. It's knee KG, which is like an EKG for the heart, but for the knee, and it allows you to record the knee in motion like a MRI image. And we're going to show some video here in a second. You'll be able to see that.
Okay.
And it will pinpoint exactly what the deviation is in the knee joint movement that is causing the dysfunction and the pain.
So to create the image of the knee in motion, are you hooking up electrodes to it?
It's an exoskeleton,
Okay.
which makes it better than an electrode. This gives you a more accurate movement in that joint, and it's just so intuitive, and it makes it easier on the physical therapist who's trying to diagnose the problem, and allows us to give better information to the doctor so the doctor can give us better guidance on our treatment protocols, and allows us to give a personal treatment protocol.
So let's talk about that, the relationship between you and the doctor, because I opened things up talking about knee replacement surgery. Very often, doctors I talk to say that that's not their first course of treatment.
Right.
They like to try more subtle approaches like physical therapy. They're relying then on you and what you're effectively doing to guide their patient, right?
Exactly, and so having this device makes us a lot more effective.
Okay, so let's say that 2 different people come in, and statistically looking at them, they're the same. They both pretty much the same weight, been running 5 miles a day for a long time. Their pain complaint is in the same part of their knee. Before this, you might have had kind of a one-size-fits-all treatment. Now you're going to look at their individual knee and tell what to do?
Not necessarily. We do have a lot of diagnostic tools, manual testing that we do on patients, and so we can pinpoint a lot of things.
Okay.
But what we can't do is what you're going to see on this video when we roll it. We're going to see specifically where the deviation is for that specific person. 2 people, as you said, might have the same pain, but it may not be happening for the same reason. This thing will pinpoint why it's happening and give you exactly what's wrong with this particular one. So you're taking a little more of the guesswork out of this thing. You're not throwing spaghetti on the wall
Right.
and hoping what one will stick. You're actually going at the one thing that we can get them better faster.
How long have you been using this?
So we've had this probably since the beginning of the year.
Okay, so what are your patients saying about it? Because does it help them to see it for themselves?
Obvious, yes, and they can see it while they're on there. They'll be on a treadmill for 5 to 10 minutes, and they can see the video of their knee. It's their knee that they're seeing in motion. So imagine you get to see what's going on with your knee, and when the data comes out and says, here, this is the deviation, it just gives you that extra confidence to know that you're going to get better.
Right. Do you know what a gait study is?
Yeah.
Is it similar to a gait study?
So it is a gait study. It's a type
Okay.
gait. So when we talk about gait, we're talking about the way you move in motion, the way you walk, deviations that might be occurring in a gait. So it is a type of gait study, but specific to the knee joint.
So when your patients come in, is it up to your physical therapist to determine if this is something that they should have or not, or would they request it?
It is. It's something that the therapists will have the latitude to say, hey, we want to do this, or the doctors know that we have it, so they'll say, we want the knee KG during the evaluation, please.
Is there a difference in how insurance covers it versus other testings?
It is not covered by insurance.
Okay.
So basically what happens here is that we see it as an invaluable tool to our evaluation. So it's just like as if we picked up another piece of equipment, our goniometer. It's just a lot more expensive
Yeah.
than a goniometer.
Well, I can tell you, I had experience with the gait study, which is why I asked, probably 8 to 10 years ago, which was a long time. And it was very impressive and amazing how thorough of a study it is. And they were able to learn things in that study that they had not been able to learn in other imagings.
Right.
So I can see how this would be very effective.
Exactly.
Okay, all of your locations have it or just a few?
All the locations have it.
Okay, so here's how you can get in touch with them, because remember, in Tennessee we are a, what do you call it?
Direct access state.
Direct access state, which means all you have to do is pick up the phone and call.
That's correct.
Or walk in the door and say, I'd like to be seen. You don't have to have that referral from your physician. And Allan has said before, if you are having pain of any kind, really better for you to get treatment early, because you're not wasting the potentially limited number of PT visits you have on your insurance plan.
That is correct.
Did I get it right?
You did.
I've been listening all these years.
Thank you.
Alliance Physical Therapy. NoPainPT.com is their website. The phone number, because they do have so many locations around the viewing area, it's just that kind of generic number. You call and you'll get the location closest to you. They'll be happy to refer you. Thanks, Allan.
Thank you.